It's kind of difficult to have figured out a treatment plan for me. My name is Clay Jarvis, and I'm from Frisco, Texas. And I'm a type 1 diabetic. I'm here at the Immunotherapy Institute to deal with stage 4 renal cell kidney cancer. I am a complex case because I've had heart stents. I'm on high blood pressure meds. It's kind of difficult to have figured out a treatment plan for me, but here at the Institute, they've done a great job. And they've made daily adjustments to make sure they're treating my cancer for me and not throwing me in a pool of cancer treatments that is typical in the United States. My niece is a doctor, and she's helped me to be able to find a clinical trial that was working with the same type of therapy, but I may or may not have been able to get in, and I was such a complex case, I needed treatment now. So she helped us find this place, and my wife and I came down to make the 18 days worth of treatment, and my niece, the doctor, showed up for the last 2 weeks of this and has been able to explain to a guy that's a contractor, not a medical person, so I don't speak that language. And so she's helped me immensely to get here, and the treatment's been superb. The doctors are all very personable, all the nurses, everything that's gone on here has been tailor-made, custom-made for my type of cancer. So if you're a type 1 diabetes patient, it's very rare to find a place like this that can treat all of what I have in the midst of attacking stage 4 cancer. So I would highly recommend it for anybody considering it, and I would do this before I would try chemo or radiation. I've heard of people doing it the other way, and I don't think they have the success that doing it this way first is the best solution. I have not had any treatment at all, because I was discovered less than 4 months ago at stage 4 cancer. So I've been looking for the last 2 years as to why I feel so bad, and I've been told this by all the doctors in America. Maybe they can help you, maybe they can help you, maybe not. And so I've done tests and scans and PET scans and bone scans, and all with no insurance because I'm not on Medicare yet. But if you're looking for a place to get treated, this would be a great place for you to consider. And I'm more impressed than I would be with anything in America. Even though my niece is a doctor, she does the great things, through the Veterans Administration and, in what she's been trained to do. But in my opinion, she's a chemical genius, and that's what I needed to decipher what kind of treatment are you going to get. Everybody's been fantastic. Day one, all open to taking care of me, making sure I'm not in pain. When I talked to Dr. Perez originally, I said, what kind of side effects are we going to have? The typical, this, that, and the other, and I made a list, and he said, no, Clay, none of that. And we're going to keep you from having side effects by changing and tailor-making your cancer treatment for you. And they have done exactly that. So I would say side effects are very minimal. Some things you get infused with will make you tired, but you expect that, But no nausea, no vomiting, that kind of stuff. I call it headache, chills, red rash, brittle bones, and the rest. So, I don't have any of those side effects. So, I feel very comfortable with what treatment I've got. The hair sample that, was sent out really told me some things that I needed nutritionally that I didn't have, and it discovered things I have nutritionally I don't need. So you've got to learn to split it all out, and so it's going to be a learning process. So I haven't conquered it yet, but at least I'm trying to make adjustments. Most of everyone else I've met is a first-timer like me, and I think they should have done a little more research so that they had a few less questions, or else they should write them down like we have been taking notes, so they don't continue asking us questions about a treatment that we've never had before. So everybody's seeking answers, you know, and it doesn't matter what type of cancer they have, because they think that their treatment's going to be like mine. So they're asking me, what am I getting for breakfast? What meds are you taking? Well, don't ask me, it's not your cancer. This is my cancer. So, and then that's what I'm happy about, is that they are taking care of me on an individual basis. And I'm not just one of 250 people getting stuck in a study. If something changes today to be different for tomorrow, you need to embrace it rather than buck the system, because they're working on you, and not everybody, you know, at the same.